Great. Thanks very much, Adele, and thanks for joining us on this journey, because I'm assuming if you're here, whatever your background, you're interested in public and patient involvement, and we hope that the PPI Ignite opportunity that Adele has mentioned will allow us to have more days like this, and opportunities to feel uncomfortable about some of the work that perhaps has been done and has not had an impact, or the impact that it might have. But we are where we are. I read a book recently called In Search of the Perfect Health System, and as you might guess, it doesn't exist. But I'm proud to be part of the HSE, and I'm a clinician and an academic, so I have a foot in both, on both sides of the Newcastle Road. For those of you in Galway, not from Galway, we're fortunate in that our hospital and our university are adjacent to each other. And I think PPI Ignite and the opportunity it presents really can bring us together and help us, or enable us to improve the lot of ourselves as a society, with living with chronic disease, with mental health, the focus of today. I'm really tempted. How important is it that we stay on time? Because I'm tempted to not use slides, but that might not be fair. Working in partnership and making an impact is the strap line. Of course, you have to come up with a strap line. But really, I think we're grateful to the Health Research Board and the Irish Research Council for providing us with this opportunity. We are one of 5 higher education institutions in Ireland funded under this call, and the job of work that we've been tasked with is to ignite public and patient involvement in our health service, in our health research community. And we've had 1 meeting so far, another 1 or 2 planned. Una Ward is with us, and we're going to be tasked with things to do and to deliver, and I hope that they're going to be challenging. I'm sure they will. But it's a great opportunity for us to lead out on this. As Adele mentioned, my own background and experience with PPI is probably best reflected in this slide. We have a young adult panel that we're really proud of. In fact, we now have 2 young adult panels, one based in Galway, one based in Dublin, of young adults living with type 1 who really have been with us on this journey of trying to reimagine what diabetes services might look like, modelled completely and almost plagiarised on the Jigsaw model of having a youth panel who influence the service. And that's where we've taken it from, and we're not there by any means, but we're pleased to be tackling this issue. And I'd like to pay tribute to Mary Claire O'Hara, whom I saw in the room earlier. Can't see her right now, and Deirdre Walsh, who are program managing our D1 Now study. This is not easy to do for those of you who are new to PPI. To do this well takes a huge amount of effort and organisation. So what is PPI Ignite about? It's about building on existing. I'm conscious that there are people in the room who have vastly more experience than I with public and patient involvement in research. Within NUI Galway, it's about bringing this expertise, this experience to bear on those who may not have that experience, who may be new to the area, and to try to influence the culture. Notwithstanding Agnes's comments about her difficulties with research ethics, when I think about PPI, I think about it a bit like if you could imagine a world that didn't have a research ethics committee. It's hard to imagine that as a researcher, but if you were tasked with creating a research ethics environment, I think that's if we're successful in 10 or 20 years' time, I think PPI should be just hardwired into the process. And I'm glad to see Agnes nodding. So we're going about it with plans to innovate, to be across the whole university, to be inclusive, interactive, and to have impact. What does impact look like? Well, I've just described perhaps one vision for impact where it becomes part of the process. These are the elements of our program of work, what we plan to do. We're in the process of forming a lay panel who we hope will influence our work as we take it forward. We have a core team within NUI Galway. We have external international advisors and partners. The research community within NUI Galway we hope will join us on the journey, but especially our lay and public and patient participants. So the team within NUI Galway, these are the people who were part of the bid. Many of them are in the room, and they will, I hope, be rolling up their sleeves shortly to take on the various work streams that we have planned. This idea of PPI catalysts, I really like the concept. I think we're still working out what exactly it means, but definitely we're open for business, and we're based in this building, which is a very outward-looking building, a beautiful, example of, I think, of outreach to the community. It's easy to get parking here, as opposed to the hospital, where it's impossible to get parking. And these things matter if you're talking about engaging with the community. And then our partners, just to put some faces on them, Derek Stewart, who's a real leader in this area, patient advocate from the UK, Paul Manners, who is an expert on culture change, Jeanette Andrews from the States, who has done really interesting work giving seed funding to groups of public and researchers to take an idea forward, and Claire Planner, who is going to be helping us with the actual training piece, because they have a lot of experience with that in Manchester. These are some of our local partners. Sailta has a patient council. Many of you may be aware of that, and we hope to engage with them. Jigsaw Youth Mental Health, as I mentioned, CRE, and I know that we have members from the Alzheimer's Society of Ireland here today who will also be partnering with us. And so the researchers, some of them in the room, we hope will find value in this and will want to participate, not just because the funder expects it, but because they see merit in engagement and involvement. Edel and myself are the front of the office, but there will be hopefully others involved. What we'll be doing is helping to support people who are interested in PPI, delivering some education and training for the researchers and also for the public and patient. And again, it was discussed earlier, and I've already referred to how do we know that we're having an impact, and we will be trying to figure that out as well. So that's it. I hope I have not taken all of the time from Dennis, but these are the elements of our plan, and the challenge for us is to be able to look, Paddy in the eye in a few years' time and say that, well, if we have not had an impact, well, I hope that we can say that we've tried. Thanks very much.
Okay, my name is Dennis Mokler, and it's been very interesting listening to people today. It's very inspiring, and I'm a lay participant with PPI, and I'm going to say how I got involved and why I got involved and what keeps me involved in the group and PPI. I suppose my background, my mental health broke down when I was very young, and I went to college when I was a mature student, and my mental health was still pretty bad at that time, and I got into music and writing and art. That my creativity became very important for me as part of my recovery, and I got involved with an outpatients music group. It was run by myself and an OT from the outpatients department in the psychiatric clinic, and we just used to get people together who were interested in music and song and singing, and we used to just have a sing-along and a session in the afternoon, and it was all very good, and it was great. And through that, I got involved with a CE scheme was researching the need for a peer support centre in Galway and for mental health. And also around that time, I got involved with the Irish Advocacy Network, which Paddy was strongly involved with, and did some peer support training and did some voluntary, took part in meetings as a representative with the Irish Advocacy Network on meetings and that to do with mental health around Galway. And I suppose, through that then I met Siobhan Smith, who works here in the university and in the nursing department and midwifery, and she asked me to take part as a layperson in their mental health research clusters. It wasn't really PPI, but it was just as an advisory kind of a thing, where they would have some of their modules for teaching, and that they would ask me advice on that and how I think they should. What things they should talk about in their modules and teach, and that, and also with their research projects that I could just give my ideas or opinions on them and that kind of thing. So I did that for a few years, and it was Siobhan that emailed me, or I think she phoned me, I'm not sure, and she told me about Adele Murphy and the PPI group here in Galway, and asked me would I be interested, and I didn't know a lot about it. I didn't really understand it. I have been involved for over 2 years. I'm only beginning to understand it fully now, really. And but I felt it was something that would be important as a layperson with experience to be of service and to help and to to be involved, and something for myself personally to be involved in, because a lot of my time is on my own with music and writing and publishing stuff at home and music at night, and it's good to get out and be involved in something different. And for me, it's something very different to what I normally do, and I'm meeting a different type of people as well. And also, the thing that keeps me involved really is it's just it was very well organised, I thought. There was great communication, and the groups always started on time and they always finished on time. There was always scones around 10 o'clock with real butter, and also there were sandwiches afterwards, and there was a chance to mingle with people and get to know people, and there was a very personal touch, but it was very professional as well, and there was always good communication and that kind of thing, and for me as well, it allowed, I was able to use my creativity, like here last year, write a song and perform it here, and that was really good for me. And I think getting to know people in the group has really helped me as a person as well. It's like I said, it's very different to what I normally do. I'm involved with artists and music people and that kind of thing. And so to be involved with academics and researchers and lay people who are interested in helping the PPI movement is very encouraging, And also, I thought, my experience with mental health at the beginning as well, I found there was a great resistance in mental health to change or to be interested in recovery or anything like that, like what Paddy was saying. So I feel with the things like PPI, you can really make a difference, hopefully, and definitely give it a go anyway, And I like the fact that the group's meetings were held in the Westwood Hotel as well, which was great. It was outside of the university, and it was in a venue which was just accessible, very accessible, good for parking and all that kind of thing, and not bad for traffic or anything like that. So I think that's about wraps it up for me. I don't think I have any more to say. Thanks very much. Okay.